Dialogue with a Doctor, featuring Southwest Florida's leading physicians.
Hello and welcome to Dialogue with a Doctor, or welcome back to Dialogue with a Doctor if you've seen our show before. This is a show where we interview local practitioners, physicians, and we have Dr. David Eichten, a practicing orthopedic surgeon here in Naples and in Fort Myers, correct? And we're going to be talking first about Dr. Eichten and what he does, but also about LIPOGEMS, which is a proprietary product injected into the knee to regrow cartilage on the surface of the knee, or you can qualify that when we talk, because I want to make sure I get it right. But anyway, first, Dr. Eichten, tell us a little bit about yourself, where you started, and how you got here.
Well, I appreciate you having me on the show. So I thank you very much for being here. I grew up in Minnesota, so it was nice and cold. So I'm happy to be here in the warm weather. So I did go to undergraduate in St. Paul, Minnesota, and then Kansas City for medical school. That was an osteopathic school in Kansas City. And the nice thing about that school is they had a rotation down here in Fort Myers. And I actually came down for my third and fourth year of medical school. So I did that with the Lee Memorial Health System. And then my orthopedic training was in Dayton, Ohio. So that's 5 years of orthopedic surgical training. And then I came back down to Fort Myers, did a joint fellowship, which is an extra year of training, and just hip and knee replacement. So I met my current practice. The one I joined is the one that I kind of met when I was rotating as a medical student.
Really? Well, that you wanted to come right back to this area.
Once you get a taste of the nice weather in the area, it was an easy decision.
Yeah, that's very good. It makes total sense. So we're going to talk about, tell us a little bit about, well, I don't know where to start. I guess we should start with osteoarthritis and what it is.
Yeah, we can start with the basics of, what makes a knee hurt and what's causing the arthritis.
Great.
Most common arthritis is osteoarthritis, and that's wearing out of the knee cartilage. So the end of our bone, the femur and the tibia, are covered with a smooth surface. That's called cartilage. The cartilage sometimes will wear out. Osteoarthritis is wear and tear arthritis. So over time, that cartilage can get thin. Once the cartilage wears out, there's nothing that can replace it until this newer technology that we have is LIPOGEMS, which we'll talk about. Before that, it was, knee replacement to resurface the end of the bone. Now with the biologic therapy, there's a potential for that hyaline cartilage to regrow. Why it didn't regenerate itself, if you tear a muscle or a tendon, your body can send new tissue and stem cells to that area and heal it. The cartilage has no blood supply. So that's why once it wears out, it's no longer there. The other forms of arthritis, rheumatoid arthritis, which causes joint destruction, post-traumatic arthritis. Some patients will have an injury when they were younger, and over time, 15, 20 years down the road, they develop arthritis. And there's some other ones, avascular necrosis, where the bone dies underneath the cartilage. So there's different reasons for the joint to hurt. All that can be figured out with the x-ray or sometimes an MRI.
Mm-hmm. So the cartilage can't regrow. And so when it's gone, it's bone on bone, as they say?
Yeah, so when the cartilage completely wears out, then the only thing left is the femur and the tibia. And when that rubs, that's very painful for the patients.
And so prior to LIPOGEMS, what was used to correct this?
So most commonly, you can do oral anti-inflammatories. Exercise does help, keeps the knee strong. And then as far as stuff to inject into the knee, it was mostly cortisone, which is an anti-inflammatory. We also have Synvisc or Euflexa. There's a lot of different names for hyaluronic acid. And that's a gel substance that gets injected into the knee. And that is approved by some insurances. And that gel stuff kind of stabilizes the cartilage, but it doesn't reverse the arthritis. It doesn't regrow the cartilage. So that's kind of the downside of some of the things that we were injecting, which is why I think LIPOGEMS has a huge potential.
So you said that you used the term, this is a biologic. I mean, we're going to put this up here just for teaching purposes. This is the box in which LIPOGEMS is contained. And actually I said, let's pull it out, but we can't because there's product in there. If you pull it out, it's ruined and it's very expensive. But tell us about LIPOGEMS a little bit.
So in the kit, the biggest thing in the kit is a mechanical filter and wash. So before, there's different ways to get stem cells, and the stem cell has the potential of turning into either bone, cartilage, fat, and when that happens, you're getting different signals from whatever area that the stem cell is in. So if it's in the joint, it'll get the signal to turn into a cartilage cell. The problem is, where do we get the stem cells? You know, do we get it from donated tissue? And the LIPOGEMS is FDA approved because you're taking it from the same patient. You're doing a light mechanical wash. You're getting rid of the blood and the oil, and you're just left with the stem cells and different other pericytes, they call them, which have the growth factors necessary to signal that stem cell to turn into a cartilage cell. We could get very scientific in huge terms, but I'm trying to keep it simple.
Mm-hmm.
But the biology makes sense from that standpoint.
So go ahead.
Right, so getting the tissue, you take it from the patient's abdomen or flank, and it's basically you could call it a mini, liposuction. It's done in the office, it's very mild. We haven't had to do anybody in the surgery center or anything like that. So the patients tolerate it very well. We numb everything. Once you get the fat, then you're doing a wash of the fat, and that's what the filter comes in. It was invented in Italy by Dr. Tremolata, and the minimal manipulation of the cells is what keeps the cells alive and allows them to turn into the cartilage.
So why is that? Is that an improvement over other, like PRP and other fat
Sure.
products? Why is that?
So PRP is platelet-rich plasma. That's taking someone's blood, you spin it down. When you do PRP, you're just getting the growth factors. So when you inject PRP, it's very good for tendon healing. We use it in rotator cuffs to help improve healing. We have done it in arthritic joints. And you're getting more of scar tissue to fill in, not necessarily real cartilage. So it's more of an acute, quick reaction. The LIPOGEMS is more of a process. It takes about 6 months to regrow the cartilage. So, but when you get done, then you have real cartilage instead of scar tissue cartilage. The other thing with the stem cells that has been done a lot in the United States is bone marrow. So you're getting the stem cells from the bone marrow, which is fine, but they found that the fat tissue has 500 to 500 times more stem cells per volume. So you're getting a higher amount of stem cells. When you take the bone marrow, you're either putting it in a centrifuge, so it's a little bit more stress on the cells, and you don't know how many cells are mature and alive once you inject them back into the knee.
But that's even also more invasive, time-consuming, and I looked at the cost was also more costly, as I recall.
Yes. So when you do that, it's more of a procedure. It's in the hospital, and you don't know how many stem cells you're going to have in that area. The other thing that I found when I did a lot of research, there's articles that say the bone marrow stem cell numbers drop as we age. So if you have a patient that is older than 50 or 60, the bone marrow numbers of stem cells are going to drop. That doesn't happen with the fat. So, which is very interesting. Now so they've had fat for a while. Plastic surgeons have used it. They've used it for other applications. Usually when they get the fat, they have to treat it with an enzyme. And the enzyme is considered a new medication. So you have to go through the whole FDA approval process as a new drug. Mm-hmm. So this, because it's called the fat transfer, you're taking the stem cells from the patient, you're putting it into their knee. It's FDA approved for that application because you're not manipulating the cells in any way.
So it's not changed, it's your fat, it's your body, you're just putting it in a different location. Correct. Yeah, that's very clean. So so that's why it's superior to the other products?
Yes.
And you used the term liposuction. I know there's somewhat of a misconception about you're not going to make somebody cosmetically better by doing this.
It's a very small amount.
It's a small amount. Yeah. How much is it?
Most patients want us to take more. So it's approximately 60 cc's.
To
And
do
then to
one
do
joint?
1 or 2 joints. It's
Mhm.
about 30 per joint. And then after you clean it and wash it, you're left with about 10 cc's.
So before you started using this product,
Mhm.
you went and researched it, and tell me about that. You wanted to make sure that this was factually efficacious.
Yeah, I think the most important thing is patient trust. And I wouldn't do this on, if I wouldn't do it on a family member. And that, just starting out, being early in my practice, I want patients to trust me. And that's kind of why I went out and kind of vetted this. We flew to Atlanta. They've been doing it up there at Emory University. So we kind of did the groundwork to kind of see, what's the best, and if we're going to do this, is it going to work? And I've been very skeptical, but now I'm not as skeptical because of the patients have been doing very well with the LIPOGEMS.
I guess we're trained to be skeptical.
Yes.
So when this is done, what kind of process or preparation or recovery time, or how does it work?
So typically, once a patient schedules for the LIPOGEM, we block about an hour of time while we're in the office to do the procedure. A lot of that time is waiting for the numbing medication to kick in, which we wait about 15 to 20 minutes to numb the area. Once it's numb, then you can get the fat, and then washing it's another about 15 minutes. Usually it's about an hour total. Once you get the fat, then we inject that into the knee. So it's a very benign procedure. There's 2 small poke holes where you get the liposuction done, and then a regular typical injection that most patients have had in the knee.
So how are they doing? How is it going?
Patients are doing very well. I've got a couple patients that were ready to schedule for the total knee replacement, and they're probably 3 months out, and they have no pain. So we have to be cautious on that because some of this could be placebo, but a lot of the stuff, they have results a couple years out in Italy where the patients have had growth of the cartilage. They have proof on x-rays and MRI, and they're a year, 2 years out, and they haven't needed anything. So, and I think it depends on your patient selection as well. Obviously, if you have a severe deformity, I'm going to recommend a knee replacement. And that's something that can be discussed in consultation.
So this can be used in other joints or parts of the body?
Yeah, you can use it in any joint. We've done some in the shoulder, either for rotator cuff issues or arthritis. We've also done some in the hip, and we've done some in the ankle.
Is the shoulder easier to improve because it's not weight-bearing?
Yes. Yeah, so shoulders and knees do well. The one that I'm cautious of is hip. If you have severe bone-on-bone arthritis, if you have mild to moderate, it may work in the hip. So the results aren't as good for the hip as they are for the knee and other joints. So it just depends on what the patient's x-rays look like.
One of the things you had mentioned to me in the past is that you want to treat patients at the appropriate time because sometimes it gets to a point where they have to be treated surgically and they waited too long. Can you tell us about that?
Usually, if the joint's going to wear out, it'll wear out typically more on one side or the other, and then as it wears out, then the patient can get a progressive deformity. So if you're wearing out this way, some patients will get bow-legged, some patients will get knock-kneed, and as that deformity gets worse, we can fix it with the knee replacement, but it's hard with that mechanical stress. You don't know what the stem cells are going to do once they're in the knee. It may be too much stress or too much chemical reaction in there to work.
And I mean, if they're not aligned, it's not going to correct that problem.
Correct.
So,
and you see that a lot with sports medicine surgeons when they do joint preservation or they try different procedures that are done on 15-year-olds, 20-year-olds that have a cartilage defect. They offload that area. So if they're not aligned properly, those procedures don't work.
So they take the load. They take the load off.
Correct.
So they've been using this in Italy for a while. We just have about a minute left. What's the data showing? How are patients doing with this? How long does it last?
We're hoping that once it's in there, it's going to last a long time. The question is, we don't know, do you need to repeat it in 2 years? A lot of patients will say, let me just do it just because I don't want it to reverse. So that's an option. And I think it's too early to kind of to gauge, the long-term results. They're starting a lot of trials now in the United States. The hope is that eventually, if we can get enough data behind it, that the insurances will start covering the injection.
This is pretty amazing stuff. We were told you could never regrow cartilage, but it looks like we can regrow cartilage. Right. Well, I want to thank you for coming to our show, and I think we learned a lot about. This is an amazing product, LIPOGEMS, and it's really amazing that you can do this, and it's so simple in the office. So
yes, thank you.
Thanks for coming. And we want to have you come. We're going to have Dr. Eichten back to talk about hip replacement surgery. So if you ever see that segment, it's going to be good too. So thank you for joining us.
At Joint Implant Surgeons of Florida, Dr. Eichten offers state-of-the-art orthopedic care. Dr. Eichten gives special attention to each patient's condition. He listens closely and offers individualized treatment plans, including physical therapy, injections, regenerative medicine treatments, and surgery. Our patients receive a high level of expertise and service which is unparalleled in any other orthopedic practice. Find out what sets us apart and where your new joints will take you. Take it from one of our patients.
I am grateful to Dr. Eichten for offering me an alternative to surgery for my knee pain. After just 6 weeks of LIPOGEMS injections, my pain in my knee has been resolved and I'm back doing what I love to do. Thank you, Dr. Eichten.